Hi everyone, welcome to another video. In today's session, we're going to be looking at the ankle. I'm Tom, a sports therapist at Austin Performance Sports Therapy, where we look to better everyone's general health and well-being. Come on in. I'm now going to take you through some anatomy and physiology of the ankle. So coming down from the knee, you've got your tibia, which is the thicker bone, and on the outside you've got your fibula. At the ankle, you've got two bony landmarks known as your lateral malleolus and medial malleolus. At the front of the foot, you've got your talus, and at the back of the foot, you've got your calcaneus. Muscle-wise, you've got your tibialis anterior running up the front of the lateral aspect of the lower limb. At the back, you've got your gastrocnemius and your soleus. At the bottom of your foot, you've got your plantar fascia. Movements of the ankle include dorsiflexion, plantar flexion, inversion, and eversion. I'm now going to take you through some common injuries of the ankle. A lot of runners can roll their ankle, causing strains and sprains. Okay, you can get stress fractures up the tibia. Because the ankle is so far away from your heart, the heart has to work harder to pump blood down to then push waste back up. So it's a common swelling point. Plantar fasciitis is a common ankle injury, which is basically the plantar fascia at the bottom of your foot becoming inflamed. Runners can be diagnosed with what's known as runner's foot, which is just a constant repetitive strain, or RSI, on the ankle. I'm here with Becky and we're going to be doing some stretches of the ankles. So the main movements are plantar flexion and dorsiflexion. So if I can just get you to point your toes and point your toes up to the ceiling as well. So if you point the toes down to the floor and then back up to your ceiling, and these are the main two movements of the ankle. Okay, and by holding your foot in that pointed down position, it's stretching the tibialis anterior. And by pointing your feet up to the ceiling, that is stretching behind the scenes. Exercises that a therapist might give for the ankle, mobility-wise, would be writing out the alphabet with your toes. So depending on what your preference is, uppercase, lowercase, just go through the ankle movements, and that is just going through the motions with the ankle. You've also got inversion and eversion, so this will take into account those. A good way in which to stretch the calf muscles would be finding yourself a set of stairs and standing on the lowest step and lowering your ankle towards the floor. If you don't have a set of steps, you can use some books. So I'm just going to plop these here for Becky to stand on. Now, if I can get you to sort of stand with your toes just at the edge and lower your heels towards the floor slowly, and you're just decreasing that ankle between your toes and your shins. So in this position, you can angle your toes in and lower your heels down, and then you can angle your toes out and lower your heels down, and this would just stretch different parts of the gastrocnemius and soleus. In fact, actually, you're stretching more the gastrocnemius with straight knees, straight legs. But if you were to slightly bend your knees and lower your heels down, you're now targeting that soleus muscle.
Can definitely say that is being targeted.
Okay, so with bent knees, you're targeting the soleus, and with straight knees, you're targeting the gastrocnemius. And relax. If you don't have stairs or books, what you can do is stretch up against the wall. And so if I can get you to put your toes slightly close to the wall and try and touch your knee against the wall without lifting your heels off the ground. If you can do it successfully, what you can do is take a few steps back and try then.
Right, maybe too far back.
So this is a good one because you can measure the distance between wall and toes, and therefore you can test improvement. Say you had tight calf muscles and you could only have your toes a few centimeters away from the wall. Do some stretch exercises, take a few, and work out if you can have your feet slightly further away from the wall and still touch the wall with your knees. I'm now going to introduce Becky to some resisted stretches of the ankle. So for that, we're going to need a resistance band. And all I'm going to ask Becky to do is put her toes over the bottom and just plantar flex and dorsiflex And that's just adding a bit of resistance to the movement, strengthening up the ankle. Perfect, then relax. So that, I suppose, could actually be used in the strengthening side of the ankle as well as the mobility side, because not only are you getting the ankles mobile, but you're also stretching and strengthening at the same time. So with some conditions like plantar fasciitis, a great exercise to do around the ankle is to get a rolled up towel and ask Becky to just put her toes, so you are putting the plantar fascia on stretch, and then all you ask Becky to do is do some calf raises. So come up onto your heels and down. What you're asking of the plantar fascia is to strengthen under stretch. So by having the toes raised, you're stretching the plantar fascia, and then by doing the heel raise, you're asking it to work. So you're stressing it under a stretched condition, and this can sometimes help get rid of plantar fasciitis. We are going to go through some strength exercises of the ankle. So one of the most common ones are just basic calf raises. So if I can get you to just come up onto your tiptoes. So it should be noted that at the minute Becky's got straight legs, so that is strengthening the gastrocnemius muscle in the back of the calf. If Becky was to slightly bend her legs and then do calf raises, you're then training the soleus muscle, which is the longer, thinner muscle underneath. So while I've got Becky standing on her feet, another exercise to strengthen around the ankle is a similar exercise to what we've done with the knee. So it's proprioception training, and it is literally asking Becky to stand on one leg. You can see around the ankle, it's working really, really hard, backwards and forwards, side to side, just to keep that stability. And what this is training is something known as proprioception within the ankle. You can make this exercise more difficult by asking Becky to come up onto her toes a little bit, lifting her heel off the floor slightly. Now, if you notice, the balance slightly changes, and Becky is now having to work twice as hard. But that's not it. So if you were to just relax for 1 second, another way in which you can make the exercise harder is if I was to ask you to go onto one leg and close your eyes. So automatically, just by taking out your vision, it increases your body's balance abilities, and so it increases the difficulty of that exercise, therefore strengthening the ankle harder. And if you really want it to be extra, you can come on one leg, you can lift your ankle off the floor and close your eyes. Very well done. But that is very difficult, so just make sure you've got some space around you when you're doing it. So if you are without a gym membership, or just want to do some basic ankle strengthening at home, if you've got a heavy pair of walking boots or welly boots or something like that, just something weighted for the ankle, you can just put those on and just write the alphabet out with your ankle. That's just getting your ankle going through all of its motions, all of its ranges of motion, but because you're adding the weight to it, you're strengthening the ankle at the same time. Now, someone asked me the question the other day whether you should do it, the alphabet in caps lock or lowercase, and it got me thinking. Lowercase is a lot more flowy, so if you fancy a nice flowy movement of the ankle, then go for lowercase, and if you fancy the bolder, more bold movements, then go for caps lock.
My dyslexia is really coming into fore here. That half of these are backwards.
You're doing it in the mirror.
I don't know. No idea.
Good.
See, there you go.
Lovely. Wicked. Huge thanks to Becky for helping us out, giving us her ankles for the stretch and strength of the lower limbs. if you find yourself dealing with any ankle pains, if you've rolled your ankle, if you've sprained your ankle, got shin splints, anything like that, don't hesitate to get in touch. We've got plenty of treatments here at Austin Performance Sports Therapy that can help with that. We've got joint mobilization. We can use acupuncture needles. They're great for just getting the ankles moving again. If you find yourself with swelling down there, you know, soft tissue work and drainage can really help with that. Resistance work with bands, another really great way to just get some strength back in those ankles if you find yourself with weakened ankles. Foam rolling is another way of getting rid of some ankle tensions. But yeah, if you find yourself dealing with any of these issues, don't hesitate, get in contact with us. Our details are on the bottom of the screen. We look forward to hearing from you, and we'll see you in the next video. Thanks.